Common questions about dying. Knowing that you have a short time to live raises many questions. Sometimes, you may not be sure if you want to know the answers. This chapter discusses some of the questions you may want to ask when you feel ready. How long have I got? Some people want to know how long they have left to live. Others prefer not to know. It's a very personal decision. Knowing can help you prepare for and plan the time you have left. If you want to know, you can ask your doctor. They won't be able to give you an exact answer. As everyone is different, a doctor can only give you an estimate, prognosis, based on what usually happens to people in your situation, but can say exactly what will happen to you. Some doctors may sound very definite about how long you have left to live, but it is only ever an estimate. Other doctors may be hesitant in case they overestimate or underestimate the time. They will probably talk about the time in terms of days to weeks, weeks to months, or perhaps even longer. It is likely to be very difficult if you are told that the time you have left to live will probably be short. Even if it is only a matter of weeks, having a sense of how much time might be left can give you a chance to focus on what you like to do. If you live longer than the estimated time, you may feel unsettled and like you are waiting to die, or you might feel lucky to be living beyond that time. It may help to talk about how you are feeling with your family, the palliative care team, see opposite page, your doctor, or a counselor. My doctor's haven't given me a date, but I preparing for the day. I getting my affairs in order and trying to make sense of things. Agnes. Will palliative care help? Palliative care is person-centered care that helps people with a progressive, life-limiting illness to live as fully and as comfortably as possible. It's sometimes called supportive care. The main goal is to help you maintain your quality of life by identifying and dealing with your physical, practical, emotional, cultural, social, and spiritual needs. Palliative care also offers support to families and carers. A team of health professionals, as well as volunteers and carers, work together to offer a range of palliative care services. The services will be tailored to your individual needs, and may include relief of pain and other symptoms such as fatigue, nausea, vomiting, and shortness of breath. Resources such as equipment to aid care at home. Assistance for families to come together to talk about sensitive or complex issues. Links to other services such as home help and financial support. Support for emotional, cultural, social, and spiritual concerns. Referrals to respite care services. Your palliative care may be coordinated by your GP, a palliative care nurse or the specialist palliative care team in your area. Palliative care teams see people with the most complex needs, but they can also advise other health professionals on ways to manage symptoms. Palliative care can be provided in a home, in a hospital, in a palliative care unit or hospice, or in a residential aged care facility. Services vary, because palliative care is different in each state and territory. See our Understanding Palliative Care booklet or listen to the Thing About Advanced Cancer podcast.
Who can help? Wherever you receive end-of-life care, the different health professionals in your palliative care team can offer a range of services to assist you. You may not need to see all of the people listed below. The palliative care team GP continues to see you for day-to-day health care issues and may coordinate your palliative care. Specialist palliative care nurse may work in a community or hospital setting, can provide ongoing care and may coordinate your palliative care. Community nurse visits you at home to supervise medical care, assesses your needs for supportive care, and works with your GP. Palliative care specialist * physician, treats pain and other symptoms to maximize well-being and improve quality of life, usually works in collaboration with your GP or palliative care nurse. Cancer specialists * oncologists and surgeons, may refer you to the specialist palliative care team and continue to provide cancer treatment to help manage your symptoms. Counselor, psychologist help you manage your emotional response to diagnosis and treatment. Psychiatrists specialists in the diagnosis and treatment of mental illness, can prescribe medicine and uses evidence-based strategies to manage emotional conditions. Spiritual care practitioner, pastoral carer, discusses any spiritual matters and helps you reflect on your life and search for meaning, if appropriate, may arrange prayer services and other religious rituals. But understanding the different roles can help you work out what support is available and who to ask about particular issues. Your care may be coordinated by your GP, a community or hospital palliative care nurse, or the specialist palliative care team. Pharmacist dispenses medicines and gives you advice about dosage and side effects. Occupational therapist assists in adapting your living and working environment, can suggest equipment, such as a hospital bed, wheelchair, and bedside commode, toilet chair. Physiotherapist helps with restoring movement and mobility, and preventing further injury. Diversional therapist offers recreational activities to improve your well-being. Dietitian recommends an eating plan and tries to use diet to assist with digestive issues, such as nausea or constipation. Speech pathologist helps with communication and swallowing problems. Social worker links you to support services and helps you with emotional, practical, and financial issues, may also be called a welfare officer. Volunteers can help with home or personal care and transport, and also offer companionship.
It's now the time to try complementary or alternative therapies. If your doctor has told you that the cancer cannot be cured, you may wonder whether there are any other therapies you could try. Complementary therapies tend to focus on the whole person, not just the cancer. They are used alongside conventional medical treatments, while alternative therapies are used in place of conventional treatments. Many people use complementary therapies to help them feel better and cope with cancer and its treatment. This is also true for people who are dying with cancer. Complementary therapies may help you relax and reduce anxiety. They can also be useful in managing symptoms such as pain and nausea. Some people find gentle therapies, such as massage and aromatherapy, helpful. People who find it uncomfortable or painful to be touched may prefer meditation or visualization. Alternative therapies are often promoted as cancer cures, and family members, friends, or even strangers may suggest you try them when you explain your prognosis. Unlike conventional medical treatments, alternative therapies have not been scientifically tested, so there is no proof they stop cancer growing or spreading. They can be very expensive and could interfere with other medicines.